Thank you all for joining us here today for our weekly briefing. Today we are joined by Monroe County Public Health Commissioner Dr. Michael Mendoza, URMC Chief Medical Officer Dr. Michael Apostolakis, and Rochester Regional Health Chief Medical Officer Dr. Robert Mayo. So let's start by getting right to the numbers. 1 year ago, we reported just 29 new cases. For the last several days, we've been reporting here 1 year later, more than 100 new cases daily. And today we're reporting 197 new cases. However, our 7-day average of new COVID positive cases in Monroe County stands at 139. So it's too soon to know if today's numbers are part of a larger pattern or just a 1-day blip in the reporting of new cases. And we're going to have to continue to pay very close attention to those numbers. Our 7-day positivity rate has been holding at just over 4%. And so we're not necessarily in a crisis situation or on a high alert yet with our new numbers. It does underscore the need to continue to take precautions that we've been recommending, even if you're fully vaccinated. The CDC still classifies Monroe County as an area of high COVID transmission. This means we recommend, and Monroe County recommends, that you should wear a mask in public indoor settings, regardless of vaccination status. You keep gatherings smaller and hold them outside if possible. Please stay home if you're sick, and be careful and cautious when traveling, and cooperate with our contact tracers if you've been called by the Monroe County Department of Public Health. These recommendations, we believe, are working because our rate of increase over the last week or so has somewhat slowed. But the day-to-day numbers, as you can see by today's announcement, in today's cases still fluctuate, and we're not out of the woods yet. We don't know what the numbers will look like in the next few weeks, but we do know there are significant variables coming into play over the next few weeks. Soon, students of all ages are set to return to the classroom in our local schools and in local colleges. This means many people from both Monroe County and other areas will soon be congregating indoors. School districts' reopening plans have been following our advice to mask indoors, and I believe that is absolutely the right thing to do in order to ensure a full 5-day-a-week reopening of all schools. I also believe it's the best way to ensure students stay in the classroom this year and aren't sent home to learn remotely if they or other students in their classroom and school test positive for COVID-19. We've already seen the damage done in other states in the country where masks were not mandated. Places like Florida and Mississippi, thousands of students have already been quarantined in the first days of their school years because of students testing positive and there being few or no masking requirements in place. In fact, just a week into its school year, the Hillsborough County Public School District in Florida, which includes the Tampa area, reported on Tuesday that more than 10,000 students and 300 staff members are in isolation or quarantine after testing positive for COVID-19 or coming into close contact with someone who tested positive. Locally, school districts have been working tirelessly with the help of the county and Dr. Mendoza, and I am satisfied with their plans and decisions. I truly believe that they will make the best decisions possible to keep our students and staff safe in the classroom all year. We have already proven to make classrooms safe places for our children and our school staff. Masking up when necessary in public indoor settings is also key to ensuring that the economy stays open. Vaccinations, however, are the long-term key to defeating this virus. There are several vaccination clinics open through Monroe County and the city of Rochester, and I cannot underscore enough the importance of this community being vaccinated. The vaccination clinics include the county's mass vaccination sites, the locations, as well as pop-up clinics throughout the city and county, and will be at upcoming events such as the Puerto Rican Festival this weekend. The same goes for testing. We have testing sites all over the county and in the city through the end of this month, and we're going to continue to offer testing so long as we see the numbers going in the direction that they are. As always, you can also visit monroecounty.gov or call the COVID hotline for additional information and if you have any questions at all around vaccine or testing. Now it's my pleasure to introduce our Monroe County Public Health Commissioner, Dr. Michael Mendoza.
Good afternoon. Thank you, County Executive Bello, and as always, thank you to the members of the press. Thank you also to my colleagues, Dr. Michael Apostolakis and Dr. Robert Mayo. As the County Executive points out, we are in a very different place than we were last year at this time. Our numbers are considerably higher. We have a new variant, and we are sure to see more variants. And there is more frustration, more so than last year, that it feels like this is never going to end. So yes, we are in a different place. But I would argue that we are in a familiar place, and in some respects, we are in a better place. We are not new to uncertainty, and we know more now than we did last year. Last year, we did not have a vaccine. We were struggling with how to reopen school for the first time in 5 months, and we did not know what the winter might bring. Now we have a vaccine and knowledge, and we need to turn that knowledge into wisdom, into action. As the end of summer draws near, and as we look ahead to what we hope will be a better year, we need to remember what we've learned and use it. Use it to keep ourselves, our family, and our loved ones healthy and safe, and to keep our schools open, and to keep our teachers and our frontline healthcare workers healthy and safe. Our primary tool is the vaccine, and we now have third doses to complete the recommended series for people with weakened immune systems. And we will soon have boosters to ensure that everyone else can protect themselves and their loved ones. The vaccine is clearly working. We know that the vaccine provides better and longer lasting protection than the infection itself. Nobody promised it would be perfect, but it is definitely working. In general, the outcomes for those who are vaccinated are better than for those who are not. While vaccinated people can and do contract the illness, unvaccinated people who contract COVID will in general get sicker. And although vaccinated people are hospitalized and some die, those who are unvaccinated have a much tougher road ahead. Of the 125 COVID deaths recorded since March 1st in Monroe County, 83% were among people who were not vaccinated, even though the vast majority of them were eligible to be vaccinated at the time. Today in our hospitals, the average age of hospitalized unvaccinated COVID patients is young, at 48. For vaccinated COVID patients, the corresponding figure is more typical of the overall hospitalized population at 75 years old. Over the past week, about 31% of new cases were among vaccinated individuals, and we anticipate seeing more vaccinated people contracting COVID, not because we think the vaccine isn't effective, but simply because of what we've known all along, that the vaccine will not prevent all infections. So with larger numbers of people vaccinated in our community, the corresponding percent of that larger number will naturally be larger. It's for this reason that we recommend measures on top of the vaccine, masking in particular, so that we can stack the odds in our favor as much as we can. Because at the end of the day, we're all sick of COVID. We all want our normal. We all want to see each other smile and laugh like we did before. But as I've said, COVID is not yet done with us. To get past COVID, we need to stand together, to stand up to misinformation as a community, because ultimately we rise and fall as a community. And we won't do it on the backs of conspiracy theories and medical advice from Facebook and Twitter. Today, we are reporting another 197 new cases, and sadly, we have learned of 2 additional fatalities. These numbers are alarming, a reminder that we cannot grow complacent. The stories of today's cases tell a familiar tale: indoor family gathering, travel, kids returning from camp followed by household transmission, gatherings with coworkers indoors. Again, all more so among unvaccinated people. We can turn this around, and we will. Good decisions now, and especially within 2 weeks of school reopening, will help to put our schools in the best place possible as they return to their very important work. If you have not yet gotten your vaccine, our community is relying on you to do your research, to speak to a trusted healthcare provider, and hoping you will get vaccinated so that our schools can reopen and enjoy a more normal school year, so that our children who are not yet able to get the vaccine can stay healthy and stay safe in school, and so that everyone else, especially those who are vulnerable, can remain protected from serious illness or worse. And with that, I want to turn it over to my colleagues, Dr. Apostolakis and Dr. Mayo.
Thank you, County Executive Bello and Commissioner Mendoza. It's a pleasure to be here today, and I'd like to thank the media. A few short weeks ago, between Strong and Highland Hospital, we had only a handful of COVID patients. Today, between the 2 hospitals, we have more than 45 patients admitted with COVID-19, the majority of which are unvaccinated, 14 of which are in the ICU. We know that vaccine is the best preventative of COVID-19. And part of the message here today is to encourage everyone out there to get vaccinated. Do it for yourself, do it for your family, do it for your community. If the numbers continue to climb as they have over the last few weeks, I'm concerned that we will get to a point that we will have to limit this, the treatment of certain patients. You know, previously during the surge, we had to limit elective surgeries. And what was elective at the time, a month or two later, may no longer be elective. So I'm concerned about patients being harmed by overcrowding due to COVID illness. Once again, COVID illness is best prevented by vaccine, masking, and social distancing when appropriate. So please, I repeat, do it for yourself, do it for your family, do it for your community. Let's work together as we have in the past to save lives. Thank you.
Thank you for the privilege to join you all here today. I am grateful for the leaders on this call and for the media who helped to share this message throughout our community. The story at Rochester Regional Health is similar to the message that Dr. Apostolakis has shared from URMC hospitals. Just under 1 month ago, Rochester Regional Hospitals had 4 patients with COVID in their hospitals. We now have 59. This is a significant change in just 3 weeks. We are tracking carefully those who are vaccinated and those who are symptomatic to understand how the vaccine is actually helping our community. The data that comes across the state and the nation is true here, right at home. It is true that people who are vaccinated do much better than those who are unvaccinated. I can tell you that within Unity Hospital and Rochester General Hospital, there are 11 patients in our ICUs with COVID. Only one of those patients was vaccinated. That means that there is a 10 times higher ratio of unvaccinated patients who are critically ill. Of those who are on the ventilator, none were vaccinated. So this is such an important message for our community. I hope that over the last 18 months, anyone who has been remiss to receive the vaccine has had plenty of opportunity to speak with other loved ones, colleagues, or friends who were vaccinated. So you have some trusted friends who can tell you how the vaccination experience affected them. And you may also know family members or other colleagues who have not only experienced COVID and recovered, but who have also passed. A few weeks ago, there was a very touching memorial downtown for all the members of our community who have died from COVID. And it was a poignant reminder that all of us need to make a difference. We can all make a difference in saving lives for the future through vaccination and the other necessary masking and social distancing measures. Thank you very much, and I'll turn it back to County Executive Adam Bello.
Great, thank you, and Dr. Mayo, and we'll turn over to Tanner Jubinville to take questions from the media.
All right, first one up, we have Berkeley Breen from Channel 10.
Thank you, Tanner. Dr. Mendoza, this week you met with school leaders. What did you tell them about high school sports, particularly football, because it's a face-to-face contact sport?
Well, I met with the school superintendents this week, as I have every week for the last 18 months, essentially, and I shared with them the experience that we have in the health department, particularly around football, which is that there really haven't been very many examples, if any, of on-field transmission of COVID between football players. I did share with them what we do know, which is that off the field, interactions in locker rooms and parties before and after games and so forth tend to be more risky. And so I left that information up to them to make the decisions that they saw appropriate for their schools. And generally speaking, they're going to be taking that evidence and applying it to what they will be doing with the seasons. I think each district has a different approach with regard to the spectators outdoors and the players on the field. but I do think that they are working very diligently to get the year started.
Dr. Mendoza, what do you think of the tension and some of the anger we're seeing at school board meetings, especially when it comes to the issue of masks?
Well, this is a tough time for people because, a lot of expectations have built up for this upcoming school year. We had a period there of 6 weeks where things felt a lot more normal. And I can understand it's hard, it's frustrating. Nobody wants to have to wear a mask in schools. But the reality is, if you step back and put this in perspective, we are looking at reopening schools fully for the first time in over 18 months. Just a year ago, that wasn't even on the table. And if you had to choose between wearing a mask or having the 6 feet of distancing, which is essentially precluded full-time in-person school, I would view that mask wearing as an effective lesser of two evils. And so I understand the frustration, but I think we need to look at the long game here, which is that we all want our kids to be back in school full-time. And if masking is the way we get there for now, I think that's the way we have to go. I've told the superintendents in the schools that we will reevaluate this consistently based on the variants as they come to our community and as the numbers go up and down with the beginning of the school year. But I think right now is not the time to take unnecessary chances.
And I would actually like to add, Berkeley, that I think that, while we're going to have differences of opinions and come to the table with that, I would ask, us to be respectful of each other and respectful of the various opinions. We've been asking for that from the public right from the very beginning, and I've been delighted that the public has been respectful of that from the beginning, understanding different choices people are going to make and tough positions that people are in. But good public policy and decisions don't come from yelling at each other. It's calm, reasoned arguments and discourse, I think, is how we get to a solution. So I would just ask the community, please be respectful of each other, particularly our young people who are coming forward and expressing their own opinions from their own lived experience. We should be listening to them.
Okay, next up we have Dan Schrack with 13 WHAM.
Good afternoon, gentlemen. Thank you for taking our questions today. My first is either for Dr. Mendoza or County Executive Bello. 29 cases to 197 from this same date last year. That is a huge spike. We know that the Delta variant is far more transmissible. Yes, we do have a vaccine this go around. However, there is still some hesitancy. At what point is a mandate issued on masks and or vaccinations for teachers, for businesses, to allow people to enter? With school starting in just 2 weeks, you do have to, you come in contact with someone who is infected with the Delta variant and find out days later that you test positive for it. Is this something that we want to wait 2 weeks before a decision like that is made?
Well, let me say this. We've made a decision now. If you look at the way the school districts have been working with Monroe County on their reopening plans, the reopening plans include wearing masks. And I want to take you back to where we were just a year ago. As we were heading into the fall, our cases were low, but as you recall, as you entered into Thanksgiving, Christmas time, the holidays, and into early winter, we had a lot of cases here. It was 700, 800, 900 cases a day at one point. Dr. Apostolakis talked about the hospitals being full. But one place that the virus was not spreading and we know that through our contact tracing, was the schools. They were not a vector for spread. And what were the schools doing? The schools didn't have access to vaccine yet, but the schools had social distancing and they had masking. And so we know that that had worked. And so I think one thing that we've learned from the very beginning of this pandemic is to look at what we know worked and follow the science and follow the data. However, having said that, the number one thing that we can do to put an end to this pandemic, and it was just demonstrated by our doctors in the hospitals based on the patients that they're seeing in there, is to get vaccinated. So we are working through the community to increase our vaccination numbers. I'm comfortable with the efforts that we're making now, but we have to continue to double down on them as we go into the fall to make sure we get as many people vaccinated as possible. So we don't set a specific number, but we, in terms of the how many cases is too many cases, and we trip that. But what we do is we also, because we don't just want to look at cases, it's important to also make sure we're looking at hospitalizations. And that's also why this is a different pandemic than perhaps we saw before, because you're going to have breakthrough cases of individuals who are vaccinated, but they may not get as sick as their unvaccinated counterparts. At this time last year, we were all unvaccinated. So it's a fluid situation that you have to look at day to day. So we look at the hospitalizations, we look at the new case numbers, we look at how sick people are, and you make adjustments. Right now, the recommendations that we have laid out from the county, which follow the CDC recommendations, we believe are working right now. But we also have to continuously monitor that. Today we had over 190 cases, whereas our average is down in the 130. So we need to make sure that we're monitoring that day to day to see where the average goes. So we're not just reacting or underreacting to each of the day-to-day fluctuations, and then make decisions based on that.
But could there, I suppose, is there a point where the county says, okay, we need to do a mask, we need to issue a mask mandate for all businesses, bars, restaurants, stores, everything across the board? And what is that point?
Yeah,
Is there a vaccination percentage?
Yeah, we're not at that point yet. And there is no set point that we have right now because it's a fluid situation. But what I can tell you is that while we haven't set a benchmark, so we have 200 average, 300 average, this is what trips a full mask mandate. What we do know is that the recommendations that we've been working with have been followed. So when we recommended businesses, we mandated masks amongst county employees, and that's being followed. You see what's happening at the grocery stores and other stores where their staff is being mandated to mask. Most of the customers are masking. It's working. The school districts, we've asked them to include masking, and they're including masking. So right now, working with people around the issue of masking, I believe is working at this point, but that's not to say that might not change. So of course, there's always a possibility of additional recommendations or mandates coming down. But right now, I think we're okay. But the one thing though that I don't want to get caught in here, and for all of us to get caught in, even in the community in general, is arguing and fighting about masks. It's a mask. We know what works. We did it last year. We were able to get the numbers down. We can wear a mask again when we're indoors in public spaces. But the number one thing you can do is vaccinate. We really have to have this conversation. That's why we have the medical professionals here as well. We have to have the conversation about vaccines, the safety, efficacy of the vaccines, because that's how we get out of this. When you have those conversations about where does all of this end, we have to get vaccinated, and we have to help people understand the choices, the decisions that are being made, answer questions, educate, so they can make the decision for themselves and doesn't feel like something that's being forced.
And can Dr. Mendoza speak to breakthrough cases with the existing numbers? I know the other two doctors were able to give us a bit of an idea of current hospitalizations and breakthroughs as far as those go. But for instance, of the 197 cases today, do we know how many are breakthrough?
No, I don't have that information at this time. In order to have that, we need to follow through with the case investigations and speak to these individuals because sometimes the vaccine status isn't readily available to us. So we have to wait to talk to those people to have that information.
Is there a generalization?
Dan, we got to move on to Sean from the Democrat. Here, sorry. Sean, you're up. Sean?
Hey, I'm here. There was Dr. Brophy from Golisano tweeted over the weekend about how many children were in the hospital there. I'm just wondering if there's been an increase in the number of kids under 12 who are showing up at the hospital and need hospitalization.
Great question. Earlier in the week, we had 2 children. I believe the data I saw today showed approximately 4 children under the age of 19 in the Children's Hospital with COVID.
Got you. And for Dr. Mendoza, is it fair to say that there are probably people who have been vaccinated and who have contracted COVID that aren't showing up in the numbers because they don't have symptoms or don't feel a need to get tested?
That's certainly a possibility. That's always a possibility when it comes to infectious illnesses. The symptomatic people are more likely to get tested, and if they get tested, we'll learn of their result in general. But it's always possible that somebody will have a subclinical illness, never get tested, never know about it, which is why we recommend masking as much as feasible, particularly indoors. We know that people who are vaccinated are much less likely to be in that situation, and even if they do get the infection, they're much less likely to transmit it, even if they have a asymptomatic disease. So yeah, that's certainly possible, but with the mitigation strategies in place, I think we can mitigate the risks from that situation.
Okay, thank you.
Thank you, Sean. Next up is Patti Singer with Minority Reporter.
Hi, good afternoon, everyone. Dr. Mendoza, when you started your comments, you said COVID is not done with us, and when Dr. Apokalakis started talking, he sighed. So it sounds like we've all been here before and we're all tired of this. What is then, how do we go back to the mental health approach to COVID, which I had talked about, asked questions about frequently months ago? Are we back to treating this as much now as a mental health condition as a physical upper respiratory condition?
Well, as a family physician, I don't really make a distinction between physical and mental health. I think they're both different sides of the same coin of wellness. And we know that the COVID pandemic has taken an irrevocable toll on the mental health of this community. And I think if we owe it to our kids more than anything else, we need to work together to get them back in school. We need to start to unpeel the onion of the trauma that our kids have experienced. And we won't know the full extent of that until we see them back in school with trusted adults outside the home to understand what has gone through their lives in the last 18 months. So that's why it's especially important that we work together, take advantage of the precautions that are available to us for those who have not yet, to ask questions so that we can get everybody on board, so that we can get our kids back in school full-time as much as we possibly can.
According to the Vaccine Hub data, and we don't have anybody from the Hub on the call, but there's still a big difference between vaccine rates in Black and Latino communities and in white communities in the county. How much now is vaccine is sort of, time of the essence, and judging how well these initiatives are working to get vaccine into neighborhoods when we still see this disparity? Is anybody able to address that, like I said, without having a Hub person here?
So we don't have a Hub, but let me address that. I think because you're absolutely right. We do have a disparity in the vaccination rates between zip codes. We have obviously our lowest vaccinated rate zip codes are located in the core of the city of Rochester, and then we also have lower than average vaccination rates on the west side of the county, far west, that I think up by Brockport. That is where our efforts have been focused over the last several months, and our partners. So at the Hub, not at the Hub, but at the task force, the county's vaccine task force, we have been working and engaged with the CBOs in the city of Rochester to reach the community that they serve and try to bring the vaccine into neighborhoods where people live, so that with the strategy being to knock down each one of the barriers. So with one of the barriers being access, we bring the vaccine into the community. So we had the slide earlier listing all our vaccination sites. The one thing that you'll see as a common denominator is that they're largely located in the lowest vaccinated areas. Then you have the access to information. And so the ambassador program, what they've done over the last several weeks is partnering with the local vaccination sites, and then going into the community to provide that education and answer questions that people might have. And we're going to continue those efforts. We're not going to pull back on any of those efforts as we head into the winter. And even as we have to ramp up to be able to offer either the third dose or the booster shots in the coming months, which the county will participate in. We're going to continue to do the community-based clinics to continue those numbers. And we have seen an increase in those numbers in those zip codes the last several months. So I do think it's having an impact, an effect, but it's just taking time. And of course, I'm as impatient as you are, but we have to continue to do that, because the best way, I think, to help people through the vaccination process right now is education, information, and working people through the decisions that they're making.
Thank you.
Great. Thank you, Patty. Next up, we have Christian Garzone with Channel 8.
Well, we know by the very nature of these variants that they aren't variants unless they're more contagious or more dangerous. Anything less than that wouldn't survive survival of the fittest. So all we can do is prepare for the unknown. And the way we do that is by doing the things that we've been doing all along. We protect ourselves from future variants by ensuring that we're all as vaccinated and as immunized as possible. And if we don't know what's coming down the pipe, wearing our mask and keeping our distance and monitoring our good hand hygiene are all the ways that we've learned work. And so while it is somewhat uncertain to know what might not be coming down the pipe, I do think we have the tools at our fingertips right now to put ourselves in a good position. Well, the clock didn't just start. The schools have been working on this literally from the moment schools closed last spring. This is game time for them. They've been working very diligently with their teachers and their parents and their communities. I'm very reassured by the work that they've put in. I think they have the flexibility to move ahead, working in lockstep with their stakeholders. And I'm very eager to see the school year started. I want to be ready to handle any challenges that come our way. But I do think that we've done everything we can at this point. But we still have 2.5 weeks or 3 weeks to make sure we continue to get it right. Now is not the time to be taking trips to Florida or Texas and coming back and being cavalier about our precautions. If you're going out of town, out of state, when you come back, you might consider getting tested. Make sure you're wearing your mask indoors in public places like we've recommended. And most of all, make sure you're vaccinated.
Can I I do want to add one thing to that. So if you think about too where we were last year versus where we are today, right? Last year, our case, 1 year ago today, our cases were in the 20s. Today, we announced the caseload almost 200. But if you think about last year at this point, there was still a lot of debate about whether or not schools were going to be opening, how they were going to open, what it was going to look like. There's a lot of uncertainty into all of that. And there was remote learning options set up and the like. Here we are, fast forward to today. We have almost 200 cases, but that same level of uncertainty about whether schools are going to open and whether or not it's going to be safe to have in-person learning it's not the same conversation anymore. Schools are opening, and they can open because they've learned from last year. And our schools and those administrators, teachers, and students in those schools went through a lot last year as the pandemic evolved and the conditions changed. But they learned a lot in going through a lot, and they've taken the lessons they've learned last year, applied them to this year's school year, and they're going to be able to open. And like Dr. Mendoza said, and I said this earlier, I am very pleased with the way the school districts have been announcing their reopening plans, because it follows the recommendations that we've been laying out that are all based on what we know worked last year.
All right. Thank you, Christian. Next up, we have Randy Gorman with WXXI.
Yes. Hi, folks. Thanks for chatting today. I realize, and correct me if I'm wrong, I guess if there were to be any kinds of lockdowns or early closings of businesses like restaurants, bars, that kind of thing, would that have to come from the state level, or with the way the numbers are going, if they got worse, ask either county executive or the health commissioner, would that be something that could be implemented on a county level? And if so, is it something that you think we're getting close to at all?
Well, it's certainly Further restrictions, I mean, obviously certainly can be handled through public health orders through the health department or through an executive order. There's limitations on what the county can do through executive orders under a state of emergency. But right now, additional lockdown measures and things like that are not under active consideration right now. We believe that people can, we've put forward the guidance that I think should be followed. It's being followed. We'll see where the numbers go.
Okay, thank you.
Anything else, Randy, or you want me to go on?
Yeah, I'm all set. Thank you.
Okay. Lastly, we have Andrew Freeman with Spectrum News. Andrew, are you on the call?